Hello, we are Group 7 reporting to the public about disparities in infant mortality rates among African Americans in the state of Florida. There are a few pieces of key background information that are important to know before one can fully understand the problem. Infant mortality is defined as the death of a child within the first year of life. Infant mortality rate, then, is the number of infant deaths in a time period per 1,000 live births. A health disparity is defined as differences in the incidence, prevalence, mortality, and burden of diseases and other adverse health conditions that exist among specific populations or groups. Infant mortality rate is an important indicator for determining population health. Unfortunately, the infant mortality rates of Florida at 6.1 deaths per 1,000 live births are higher than the national average of 5.9 deaths per 1,000 live births. While that doesn't sound like much, it's still higher, and the reason for the increased infant mortality rate mostly stems from one population of Florida. The causes of this disparity are deeply rooted in the American health system, as well as insurance and other factors like access to care. As stated previously, Florida's overall infant mortality rate is 6.1. The image to the left depicts the differing mortality rates by county. Those shown in darker blue have higher infant mortality rates, depicting that there is geographic disparity. When the infant mortality rate of Florida is further broken down by race, it is clear that there is an unbelievable disparity, specifically for non-Hispanic Black women. In the graph to the left from the Florida Policy Institute, an infant mortality rate of 10.68 is reported for non-Hispanic Black women, which is nearly double the national rates. We are highlighting Dr. Karen Harris, Chair of the Program Services Committee for the March of Dimes. March of Dimes is an organization that specializes in trying to reduce the amount of preterm and infant mortality rates amongst women, especially within the African American community. Here is one quote from Dr. Karen Harris, who is in charge of the Program Services Committee in Florida. Although we have no definitive explanations for why prematurity affects the African American community more than others, poor prenatal care, malnutrition, socioeconomic status, genetics, stress, and unhealthy habits such as smoking might all be contributing factors. The factors that Dr. Harris states here are common contributors to explaining why there is a racial gap in infant mortality rates. Implications of policy and research include narrowing the gap in racial disparities when discussing infant mortality rate. Overall, maternal health has been linked to influence the health of newborns. Thus, by focusing on African American women's health, we can ultimately reduce the infant mortality rates of African American children. One major way to improve maternal and child health is to expand health care coverage for African American population. Currently, only 87% of African American women of childbearing age have health insurance coverage. In southern states, such as Florida, the coverage gap is a common issue among African American women who earn too much to qualify for Medicaid assistance, but at the same time cannot afford to purchase health insurance through the Affordable Care Act. In order to target infant mortality rate, it is necessary for policymakers and healthcare professionals to incorporate healthcare programs and policies that are culturally competent and beneficial towards African American women. By doing so, African American women can become more educated on the correlation between their personal health and their children's health. Furthermore, increased access also helps to relieve stress that comes with finding a healthcare professional. One survey by the National Partnership for Women and Families found that approximately 22% of African American women have experienced some level of discrimination by a healthcare provider. Historically, African American women have faced reproductive oppression and still continue to experience reproductive disparities. For instance, African American women are more likely to report having been pressured by a healthcare provider to use a contraceptive method or to follow a certain management of care, even if the patient's health is not in the best interest. There are several solutions to addressing infant mortality, especially the white-black disparity that exists. By providing preconception care, prenatal counseling, and other preventative services, infant mortality rate can be improved statewide. Our health communication plan focuses on strategies that are all-inclusive of the population and allow information to be relayed to people of many backgrounds, locations, and statuses. Through collaboration with an organization such as the Healthy Start Coalition, which is already prominent in communities with higher infant mortality rates, our team would develop a webinar series or short informational videos that are easy to understand and act as an information guidebook. However, they would be delivered in a more modern platform such as Facebook or Twitter. Weekly videos would be produced on a specific topic, such as access to health care, maintaining proper prenatal care and checkups, and preventative measures to reduce infant mortality rates. The videos would be produced in both English and Spanish in order to reach a wider demographic. This method would hopefully increase awareness of the issue and get parents more involved and enthusiastic about properly maintaining their health and taking tips and advice from our series that would hopefully help in raising a healthier, more thriving child. For more information, please visit the following sites: